Well, it is that time of year when you pick your health insurance options during open enrollment. But there is a big question. Has the coronavirus affected health insurance rates? Tonight, our 5 on Your Side investigators are getting you answers.
Jonathan Walsh found experts with the information you need to avoid mistakes when signing up for coverage.
I couldn't live without insurance. I'm diabetic. Without insurance, I don't know what I would do.
John Gill from Solon, as usual, will soon enroll in his company's health insurance plan. But this year has been unusual in the U.S. 8 million Americans have had coronavirus, and that care costs.
I would think that COVID's going to make things go up, I would assume.
But Dr. J.B. Silvers from Case Western Reserve University says probably not.
It looks like rates are going to be pretty stable.
He tells us because people were not allowed to get some procedures earlier this year or have been afraid to go to the doctor, that means insurance companies have done pretty well financially.
The premiums keep coming in and the costs are low.
But Silvers says if you've put off important, needed medical care, that could eventually cost you.
Did you defer things that really should have been taken care of? In which case, then you're going to pay me later rather than paying me now. That's the problem.
This isn't a typical year, is it?
No.
Liz Weston is an author and finance columnist with NerdWallet.com. She says just going with the same thing you did 12 months ago might not be wise.
They wind up spending about $2,000 more a year than necessary because they aren't paying attention to how their plans have changed.
Other mistakes people make during open enrollment is the temptation to just select the cheapest coverage. But that comes with a much larger deductible.
And these high deductible plans have really taken hold. That's fine if you have the cash set aside to pay for the care that you're going to have to pay for out of pocket. But a lot of people don't have that cash.
Especially people who've lost their jobs because of COVID, and with that, lost their health care insurance. That could force Americans into Obamacare. Now, if that's you, make sure you apply for financial tax help available that will lower your premium.
And that's the route, I think, especially if you've lost your job, that most people are going to want to take.
Now, if you already have Obamacare, in the fine print it says you have to spend at least, depending on your coverage, between 80 and 85% on pure medical costs. If you haven't done that this year because of COVID, maybe fear or something else, guess what? You're going to get money back.
Already this year, many companies are giving rebates back for 2019, but they're pretty small. Next year, they're going to be really big.
Pluses and minuses in the shadow of a worldwide pandemic as real people choose their options during open enrollment.
Hopefully the cost doesn't go up too much. Sometimes that's a big part of it.
And it's not taking my whole income to be able to support my health care.
Costs are top of mind in America, a country that the American Medical Association says spends more money on health care than any other nation.
Wish insurance was less money. That's what I wish.
I'm 5 on Your Side investigator, Jonathan Walsh.
Now, both experts we talked to say in the upcoming year, you should take advantage of telemedicine, which is meeting with doctors over video chat. That could help with your overall care at lower costs, and it avoids putting off important visits.